Hello and welcome to the NJ Life and Health video on Medicare prescription drug plans for the year 2024. So to get started, this education is about how Medicare prescription drug plans work, whether it be with a standalone prescription drug plan that goes in conjunction with original Medicare, or with a Medicare Advantage plan that includes the prescription drug coverage. So first things first, every drug plan has four basics. The first, on the standalone side, typically not on the Advantage side, is a monthly premium. Most standalone drug plans have a monthly premium. And then there are three other things that we're going to walk through in this video. One is called the formulary, two is tiers, and three are the coverage stages. So let's dive in. Number one, almost all standalone drug plans have a monthly premium. Some Medicare Advantage plans do not. That's our biggest differentiator between the standalone and the Medicare Advantage, is having a monthly premium. Now, for this year, 2024, premiums for the standalone drug plans can range anywhere from $0 a month all the way up to a little over $100 a month. There's a vast range. And to keep it simple, the drugs that you take will typically funnel you towards one plan or another, and that's going to affect the premium that you pay. But one big misconception is that it's not as if paying a higher premium gives you coverage for more medications. Typically, no matter the cost of the drug plan, the formulary, which we'll get into in a moment, which is the book of covered drugs, covers about the same amount of medications. All right. So first things first, we've got ourselves a premium to pay in most instances, but in some scenarios, we will not. Okay. Number two, the formulary. If you've never heard this word before, it's an important one, and I definitely want you to hold on to this piece of the presentation. A formulary is very important. Very simply, a formulary is a list or a book of covered drugs. This is your plan's book of covered medications. And it is so important that if you don't have a copy of one of these, that you get one each year. You can always call your provider and ask them to mail you a formulary, or typically we will always email you a copy of that formulary as well. Now, this formulary or book of covered drugs is the guide to your drug plan. Always bring it along with you to the doctor's visit. Now, a lot of people think, I can't bring a book of drugs to my doctor and tell him or her what to give me. I can assure you, the doctor will much more appreciate you providing them with a book of covered drugs rather than calling their office from the pharmacy upset that the drug is not covered because you didn't check if it was in the book or not before you got there. All right. So no matter the price, most formularies typically have around 3,000 medications in that formulary. Okay. And by law, they must cover brand name and generic drugs. It's not as if a lower cost drug plan doesn't cover any brand name drugs. They all have to cover brand name and generic by law. And they've got to cover drugs in every single therapeutic category, which means whether it's blood pressure, cholesterol, diabetes, or any sort of ailment, every drug plan has to cover drugs in every therapeutic category. And they've got to cover brand name and generic drugs. So as we summarize, every plan, standalone or Medicare Advantage, is going to have a formulary. The formulary is your book of covered drugs. It tells you what drugs are covered. Okay. They all cover around 3,000 medications if we're giving it an average. And they all have to cover brand name and generic drugs and cover drugs in every therapeutic category. Now, how do these formularies differ? Well, simply enough, the formularies differ in the drugs that they cover. They all cover drugs in the same, therapeutic categories, but they're going to cover different drugs in the same therapeutic categories. For example, say that there were 30 blood pressure medications in the world, right? I'm probably a little few, but say that there are 30 blood pressure medications in the world. You might find that company A chooses to cover these 15 blood pressure medications, and company B chooses to cover those 15 blood pressure medications. And depending on what blood pressure medication you took, for example, would funnel you towards one company or another based on the medication that they cover. So again, every company has to cover drugs in every category, but they're going to cover different drugs in the same categories. A lot of times I like to akin this to a restaurant. They might offer Coca-Cola, they might offer Pepsi. Depending on which one you prefer, you might head in one direction or the other. Okay. So that just pops up on the screen when I explained a moment ago. Depending on what medications you take, you're going to be funneled one way or another, depending on what drugs the company covers. Okay. So in summary, because the formulators choose which drugs they cover, the drugs you take, if any, are going to funnel you towards one plan or another. All right. So a summary so far. Almost every standalone drug plan has a monthly premium. In some states like New Jersey for this year, some plans don't have a monthly premium. okay? They're all going to have a formulary or a list or book of covered drugs. They're going to cover brand name and generic drugs in every category. And you should definitely consider getting your hands on a copy of the formulary and bringing it along with you to your doctor's visit so that you can always make sure the drugs that you're being prescribed are covered by your plan, okay? Now, number 3, every drug plan will typically tier your medications. And most often they tier them 1 through 5. And that's going to determine how generic or brand name the drugs are. More so, it's really going to determine the cost associated. Because what we find is that the lower the tier of the medication, the lower the price. And the higher tier of the medication, the higher the price. 99% of the time, this basic factor holds true. The lower the tier of your medication, the lower the price. The higher the tier of your medication, the higher the price, okay? Some companies have an exception where they've created what they call a tier 6. And the reason I call it an exception is that tier 6, although the highest tier won't be the highest price, it's a special category that people have made for extremely common maintenance medications or diabetic medications where they're capped, either at a $35 copay for things like insulin or between $0 and $35 for other maintenance meds. The most common example we see is that some of the most popular diabetic medications have gone into this tier 6 where they might have a $5 copay. All right. So to summarize, every company will tier your medications. The lower the tier, lower the copay, higher the tier, higher the copay. All right. So this graphic just illustrates that. Lower the tier, typically the more generic, okay, and higher the tier, typically more brand name, but that's not exactly always the case. It's safer to say that the lower the tier, the lower the price, and the higher the tier, the higher the price, okay? Companies will tier your medications to determine the copays, and you can find all of those tiers in your formulary or your book of covered drugs. Another reason why it's so important, all right? Last piece, just about done here. So every drug plan, Medicare Advantage or standalone, has something called coverage stages. And these are the stages that you live throughout the year that may affect your drug plan prices, okay? The first stage is the deductible phase. Now, some plans don't have a deductible, so you may not have this phase, but this year, the majority of plans have a deductible, okay? And if your plan has a deductible, what that means is that you pay the full retail cost of the drug until the deductible is met, and then you get to move on to the next stage. But the good thing is that these deductibles don't always apply to lower tier medications. A lot of companies have it so that your lowest tiers, typically tier 1 and tier 2, don't have a deductible. So that deductible really just applies to tier 3 or higher medications, okay? Now the average deductible this year, or the max deductible, which unfortunately is the average, is about $545. So first things first, every drug plan or the majority will have a deductible. If you have higher tier drugs, you meet the deductible first, typically. And if you don't have higher tier drugs, a lot of times you get to skip this stage and move on to the next stage. The next stage they call initial coverage. It's what I like to call the copay phase, because in here, you'll pay a copay for your drug or coinsurance based on the tier of the medication. Lower the tier, lower the cost. Higher the tier, higher the cost. Simple as that. And for most people, this is kind of the entire year. Maybe you have a deductible up front. Maybe you don't have to meet it based on your drugs. And then you enter the copay phase and you just pay your copay. Low tier, low cost, high tier, high cost. Now, for some people, that is not the end of the story. Because we see here on your screen, this initial coverage phase has kind of a window from the price that you paid to meet the deductible all the way up to $5,000. Now, $5,000 is the limit spent by your company before they boot you out of this phase and move you on to the next, okay? So again, you get to stay in this copay phase until your company spends $5,000 on medications for you. If you're just taking simple generics, probably not going to spend that kind of money. But if you're filling a $1,000 medication, maybe something like Ozempic or an expensive heart drug like Eliquis, these drugs have really high retail costs. For example, Eliquis costs almost $1,000 retail every month for the company to buy. If you only have a $5,000 limit before they boot you out of this copay phase, well, after the 5th time you fill that $1,000 Ozempic, you'll be moving on to the following phase, which is called the coverage gap or the Medicare donut hole. And simply enough, when you hit the donut hole, they charge you 25% of the cost of the medication. Again, rather than a nice copay, if you get booted into the donut hole for spending too much money on medications or forcing your company to spend too much money on medications, they move you out of the copay phase and into the donut hole. and you pay 25% instead of the tiered copay. All right. So as of 2024, after the donut hole, it's over. Okay. Once you leave the donut hole, you hit the catastrophic phase and you will no longer pay any cost whatsoever. The company picks it up at 100%. Now, there's a little bit of a convoluted calculation that goes into getting out of the donut hole. And what it is that getting into the donut hole is that the company spends $5,000. You and the company spend $5,000, which, most of that's on the company. To get out of the donut hole, it's about you spending up to the $8,000 limit, meaning it doesn't matter what the company spends. It's about what you spend, but they throw in a little, a phrasing that says, it's the amount of money you spend minus 70% manufacturer's discounts on the medications. To keep that statement really simple, typically it's about, okay, this is an average, not an exact number. It's about $3,000 that you will spend out of pocket before you leave the donut hole and you move into that final stage of catastrophic and pay nothing. Essentially putting around a $3,000 out-of-pocket max on the drug plan for 2024. And luckily in 2025, there is an actual legitimate hard stop cap of a $2,000 out-of-pocket max being put on drug plans. So that is coming right down the pike. So to summarize, most drug plans have a deductible up front. Then you move into the copay phase where you pay a copay or a coinsurance based on the tier. Low tier, low copay, high tier, high copay. And if you spend too much money, they boot you into the donut hole where you pay 25%. If you spend even more money, around $3,000 out of pocket, then you move into the final stage where they pick up all the costs. Okay. So to summarize, every drug plan has a formulary or a book of covered drugs. Get your hands on one. All right. They use tiers to determine the copays of the coinsurance. Lower the tier, lower the price. Higher the tier, higher the price. And those coverage stages determine your cost throughout the year. In total, all right, your drugs are going to push you one way or the other. And when you first join into Medicare, we'll help you determine where your drugs lie and what company that pushes you towards. And then each year thereafter, if need be, we can always help you walk through what that looks like. But if your drugs stay the same and your plan stays the same, some years you'll be able to stay put exactly where you are without having to worry about making any changes. So hopefully that was a helpful education to you. That is how Medicare prescription drug plans work on the standalone or within the Medicare Advantage side. We'll look forward to speaking with you soon. If you need anything, give us a call at 848-226-6897.